I'm Marissa Schaefer.
And I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists.
Today, we are interviewing Dr. Daria Oller. Welcome.
Thank you.
Yeah, of course. We are actually in Manhattan. She came in from Jersey. Daria Oller is a New Jersey native. She has both a degree in athletic training from James Madison University and her doctorate in physical therapy from Seton Hall University. Daria worked as an athletic trainer for NYU from 2006 to 2010 and for Penn State University's intramural sports program from 2010 to 2012. During her time at Penn State, Daria worked towards her doctorate of philosophy in kinesiology. Her work on the epidemiology of adolescent sports injuries has been published in the Journal of Athletic Training and Clinical Pediatrics. Daria is an avid tapper and has taught dance classes at the Central Pennsylvania Dance Workshop from 2011 to 2014. She's also taught injury prevention classes to tappers. Currently, she works at Foundations Physical Therapy in New Jersey.
Daria is here today to discuss tap dance injuries. Let's dive right in.
Okay, so what makes tap dancing unique to other types of dance?
Probably the biggest thing is that we are a percussive form of dance. So we're basically making music with our feet when we're dancing. Tap is one thing I think is really interesting. It's an American art form. It started here as coming up with jazz music in the early 1900s. We have special shoes. Our shoes have aluminum plates under the toe and under the heel so we can make music. When you tap dance, anytime your foot hits the ground, you're making a sound, so you have to be aware of that. So I know in other styles of dance, when you land the jump, you always hear toe, ball, heel. Mm-hmm. If our heel comes down, that's another sound. So a lot of the times when we land the jump, you essentially kind of stop on your toes, and if you put your heel down, it's a separate, very deliberate thing. You always have to be aware of the extra sounds that you're making. Mm-hmm. When we look at our shoes, they're instruments. It's no different than having drums, having a guitar, something like that. And in addition to the aesthetic and everything with every other style of dance, we're concerned about the musicality. We're playing with the tones and the volume and the timbre and everything of the sounds that we're making, which I think is really fun. It's my favorite part. My director in Tap Life, Anthony Lacascio, had said that if you're a dancer, your job is to defy gravity. So for us, that means when you're up in the air, you make sounds with your feet before you land, wow. Which is difficult, but it's a lot of fun. And something else, when we in tap, I sort of think of this as like a ready position in other sports. When your knees are a little bent, you're in sort of a squat to get ready. It's rare in tap dance that you're going to be upright and stiff and have extended knees. So your knees are always a little bent. Probably different than other styles of dance. The muscle in front of our shin or tibialis anterior is strong, and we focus on that a lot. Where other styles of dance, you're up on your toes or plantar flexed and releve. We have to be able to dorsiflex our ankle quickly, often. But then also when you're tap dancing, you have to have, for the most part, a loose, relaxed leg. So it's a weird being able to have the tension you need to make a sound, but at the same time not holding tension everywhere. Mm.
So just to like super like real quick, when you say dorsiflex, you just mean like flex your foot,
yes.
Right? Okay.
Yes.
Great. What types of injuries do you see often with tap dancers, and why is this?
So this is interesting because I'm a big nerd, and when I go to PubMed or something to find research articles, there isn't much on tap dance at all. So this is just from my personal experience and speaking with other dancers at different levels. Probably the most common, but not super severe, is blisters. When you get new tap shoes, especially professional tap shoes like the ones that I have here and have photos of them, they're leather, they're stiff. So it's common for tap dancers just get, friction and blisters. Mm-hmm. Lateral ankle sprains seem to be common because we have to do steps where you sickle your foot, where in most other styles of dance, that's no, you stay away from that. But we have steps where you are up in the air brushing your foot into a sickle, mm-hmm. or some advanced tap dancers will actually stand on the outside of their foot like they are sickled while they dance. Plantar fasciitis happens if you don't have a strong enough, supportive enough shoe. Because if you think about it, we're constantly banging our feet into the floor. And if you don't have something under your foot to help support your arch, you start to get a lot of stress. From just sort of anecdotally speaking to a handful of different professional tap dancers, like what injuries do you get? Mm-hmm. I got a lot of just general hip pain, IT band pain, and kneecap or patellofemoral pain, which from watching people, I think might be coming from some hip or glute weakness, and mm-hmm. they might not be in the right position when they're tapping and when they're landing all of their tricks. Low back pain. I think with tap dance, we often focus on feet and lower legs. But if you don't have a strong enough core to hold your body where you need to be when you're tapping and you're in a kind of funky position, that adds a lot of back stress, especially thinking how much we're pounding and jumping. And then tendonitis, I think, on the posterior tibialis, or at the inside of your ankle, and that's coming from, well, I said you need to be able to sickle and control it. It has to be purposeful. So if people are sickling because they have no control over their ankles, that seems to be leading to the tendinopathy.
And the tibialis posterior, it makes that the muscle you said goes by the inside of your ankle. It makes the sickling. Is that why?
Yes.
Okay.
Yeah.
All right. Just making sure. And then also for our listeners, Daria, you mentioned lateral ankle sprains. We have a whole episode on lateral ankle sprains. So for anyone who's listening and wants to learn a little bit more, go back in our history and take a look at Meredith Dakes.
Also, I wanted to follow up. You were describing a leather stiff shoe. Since we're going to be providing pictures, would you just describe which picture they should refer to when
Sure.
you're describing that?
Yes. I have, you'll see pink tap shoes. They're
those are the
adorable.
leather stiff shoes.
And my black tap shoes with the pink laces also. So they're made of, it's real leather. And when you initially get them, they hurt. And they're a little painful to get in, but they're a high quality shoe. So you're getting support not only from the sole, which is solid, but also from the upper part of the shoe that's surrounding your foot. And then underneath the shoe, which I'll show you in the photos, the shoe doesn't give. There's no sort of bend. You can't really point your foot. There aren't many tap steps where you should point your foot. So you have a lot of support coming from underneath. And just to explain the shoes a little more, we have a solid toe box. So if you hit the tip of your toe, it's safe. Like if you did that saying like a ballet slipper, that would hurt. So there's a solid toe box in that too. So this way you can make the sounds you need to, but not have to worry about actually injuring your foot. With Oxford style tap shoes, which are fairly common, the heel height can vary a little bit, not by much. It's not, a high heel, but that can vary. And then the thickness of the sole in general, you can get them custom made. Some people like a thinner sole. Some people prefer a thicker sole for comfort or for sound. So when you get a professional tap shoe, you can customize whatever you would like.
That's so helpful. And to clarify, the sole, you mean right at your toes, underneath your toes, that area.
Underneath the foot. Yep.
Wonderful.
Yeah. And then with the high heel tap shoes, so these are the tan shoes. On the bottom, you have the option on flat shoes too. You have the option to have leather. Most professional tap dancers don't put leather on the bottom of a flat shoe because we have to be able to slide on the floor. But with a high heel, obviously your weight is changing and it's a little more dangerous. So most people choose to put rubber on the bottom.
Nice.
Great.
Ooh, which actually, can I add something too?
Yeah, of course.
I forgot to say before. With the uniqueness of tap dancing with shoes, our floor is really important. So with most other styles of dance, you have a Marley floor, which is safe. But for tap, it's sticky. It's a very sticky floor. I actually heard a story recently of a great young dancer who strained a muscle in her thigh because she went to do a slide and was used to being able to slide, and the floor didn't let her. So ideally, you want a hardwood floor. And they're not always easy to come by in studios because it's expensive, and Marley is preferred for the other styles of dance. But we're used to having a certain give between how sticky it is and how slippery the floor is, and the hardwood provides that. And it sounds much better.
Yes.
Thank you.
So circling back around to injuries and such, are there other areas of weakness besides perhaps the glutes that you often see with tap dancers?
Yes. The soleus. So when we tap dance, like I said before, when your heel comes down, you're making a sound. So a lot of the times we're on the balls of our feet if we're not meaning to make a sound. So you have to be able to be on the balls of your feet with your knees bent and hold that position strongly. When you are in a solid sole shoe, it's harder than being barefoot or in a slipper or jazz shoe because you have to work against the shoe. So I'm saying you have all this support, which is great, but you need the strength to push through it. And you'll see dancers who don't have that, besides the soleus weakness, they'll actually start to sickle on their feet again. So I've looked at all these different photos, and tap dancers post photos of their shoes all the time, and they'll have a wear pattern that's underneath it's underneath basically like their pinky toe and their fourth toe, which tells me that when they're tapping, they're sitting on the outside of their foot, which you probably shouldn't be doing. And then also, something that I don't think we think about a lot with tap dance is upper body. And because we have to generally have a relaxed upper body, it's easy for our shoulders to come forward and sort of look hunched over. And I've actually worked with tap dancers who have had shoulder pain because of that.
So to clarify, when you're saying the soleus, you're referring to the back of your leg, correct? Awesome.
Something else with tap dance, where I was saying before, the emphasis is on the musicality and the sounds that you're making. There's still an aesthetic. There are still tricks that we do, some people more than others. But I see this a lot with younger dancers. They're so excited and eager to do tricks. And if they are not solid and strong, it gets very dangerous. When I was saying before, the sickling, we do wings and your feet come out to the side. That's where you have that sickle. And if they can't quickly go from being in that little sickle to coming back to the balls of their feet, you can sprain your ankle. And then there's a step called toe stands where you jump up to the tips of your toes. It's very different than point. You could, but you're generally not stepping into it, and your knees are bent. You have to be in a little squat when you do it. And if they don't have the strength to be all the way on like the tips of their toes, you'll see them start to sickle or kind of start to lean back a little bit. And within tap, you have such a small span of time to get that sound in. And when they're rushing, that could cause them to roll over their ankles.
That's great. Looking at this wonderful assortment of shoes here, I was wondering, you have 4 pairs right now. That's amazing. Which one here do you think is best for injury prevention, or can you think of a better shoe that would be better for injury prevention?
In general, it's just ideally a professional tap shoe that has a solid sole. There are a few different companies that make them, and everybody has their preference why one company or the other. One isn't necessarily better, it's just a preference. It's a solid sole, and I know for children, you don't always want to get a professional shoe because they're expensive. They last, but if they're growing, that doesn't matter. So there are some shoe companies that have a less expensive version. So you have the support, you have some of the stability you need, but you're not spending $300+. Usually for beginner tap dancers and kids, I don't recommend high heels just because they have, I call it like the baby giraffe legs, and they're not sturdy as it is just walking, and then make them go even higher on the balls of their feet and do tap steps, and it's usually asking for an injury. So I would say with high heels, waiting until you're strong and stable before moving into them. And just, you want to stay away from the split sole tap shoes. I use the hashtag Say No to Split Soles on social media. Someone made me a great shirt with it. So the reason people use split sole tap shoes, the reasons that I hear when I ask why, is because the shoe literally bends in half. And they say, but I could do toe stands in them. But if the only way you could do toe stands is in a split sole, that means you are not strong enough to do toe stands at all. They actually found a photo just in a Google search where there was a girl in split soles, and rather than pointing her ankle, she was bending at her toes where your foot meets your toes. That looks so scary. And then I'll also hear people say, oh, I can point my foot. I'm like, but you really don't need to point your feet in tap. So the split soles you really, really want to stay away from. I know they're popular and trendy for kids in competition dance, but you would never see a professional tap dancer in split soles, and a professional would never recommend them for anyone.
Good tip. Good tip.
Yep.
So are there certain exercises that you can perform to aid in prevention of the more common injuries you see?
Yes. The first thing, kind of general glute medius strengthening. So what that means is you have your glute medius muscle on the outside of your hip, and I'll see when people are standing, they're ready to tap, and they're bending their knees buckle in. And we see this across the board in dancers. So when you're doing, say, just regular squats with a resistance band around your knees, so you're engaging your glute medius. So this way, when you go to stand and tap dance, you already know how to find it. Or clamshells when you're lying on your side with a resistance band around your knees and picking your knee up. Just typical general hip strengthening. I recommend for tap dancers to work on doing forced arches barefoot and in their tap shoes, separate from when you're actually tap dancing. So barefoot, so you know how to go into that forced arch without sickling, and then work in the shoe so you actually develop the strength to push against the shoe to be there. One thing I think is overlooked is specifically isolating that muscle in the front of your shin I talked about before. So I'll have my patients stay in like a little squat, keep their body completely still, and just flex their feet, either one at a time or both together, depending where they're at. Because if a tap dancer needs to shift their whole body back to get their foot off the ground, that means the rest of their leg's not strong enough yet. So it's important to just isolate out the muscle in the front of your shin. And then also, this sounds counterintuitive in dance, but practicing jumping, landing on your toes. Because if you're doing other styles, you have to make sure you put your heel down. But like I said earlier, when we jump, if we drop our heel, it's a separate thing. You will stop and then put your heel down. So you have to be able to find how to land a little jump. We don't jump high usually. A little jump, solid, not let your ankles wobble, and then separately drop your heel. And then the last thing, when we were talking before about your calf muscle, the soleus, making sure you stretch it. Because for us, since we're always on the balls of our feet with our knees bent, it's easy for that muscle to get tight. So making sure you're stretching afterwards. Because if you don't have enough, if that muscle's tight, you're not going to be able to flex your foot as much as you need to make sounds.
Do you recommend a particular warm-up and cool-down for tap dancers, and why?
Absolutely. All tap dancers will laugh when they hear this, to actually warm up and cool down.
Yes.
Because when you do other styles of dance and your legs up over your head and all that, you are more aware, I think, that you need to go through a warm-up. But for us, we're like, all right, I'm ready to go. I'm just going to go do some steps. I think it's important to actively warm up your hips. It could just be going through some squats. It could be hopping on a bike, something to get your legs loose and warm. And as I mentioned before, working through your feet barefoot and in shoes, because even though you can't see it since we're in shoes as opposed to in barefoot, but we have to be able to articulate through our feet a lot and very, very quickly and precisely. So going through like maybe what you would do in like a ballet or a jazz class, doing the little demi points, working through, just making sure you're working through your feet a lot. Doing isolated ankle movements, whether it's just flexing your foot and pointing your foot, doing little ankle circles, maybe spelling the alphabet with your ankles. Because we do movements where you have to be able to isolate your ankles and you have to switch between using your whole leg and isolating your ankle quickly. And then also, if you're going to be doing tricks like pullbacks or wings or toe stands, my preference for this is to do the preps for them where you're going through the motion on one leg but not putting weight on the leg. So just so you're ready, whatever you need to be warmed up in your ankle is ready to go, but you haven't actually gone into the step yet. And besides, just on the artistic side too, besides that it's safer to have a good warm-up, then you don't miss your sounds. If you're not warm, you're going to miss your sounds and get frustrated. I see sometimes with tap dancers that I think if they do other styles of dance, the tendency to overstretch. I remember seeing a tap dancer once before a show with her doing a front split with her leg up on a yoga block. That's not what we do. So you want whatever your warm-up is to be specific to what you're doing. So for us, unless you have some really funky choreography, the need to overstretch and hang out in these big splits is probably not the best way to use your time. And then to cool down, it's sort of, with every other style of dance, you don't want to just go from tapping a lot and quickly to just stopping, making sure you're going through some slower motions again, to work through your feet. Good time to do some static stretching, even to foam roll, and making sure you're not just dead stopping as soon as you're done.
Mm-hmm. Good advice. Okay, so now let's go outside of the studio. Can you speak a little bit about specific ways that tap dancers can take care of their bodies outside of class?
Yes. I think a big thing is, and I've heard other speakers on the podcast say this, proper footwear.
Yeah.
And I'm guilty of this. Flip-flops are not ideal because we're pounding on our feet so much. And if you're in flip-flops or something like that, there's not a lot of support. So you want to make sure you're choosing a proper supportive shoe when you're not dancing. And I think also caring for the skin on your feet, because it's just, it's a badge of honor. Dancers have ugly feet and blisters and all of that. But as we all know, you can get a blister, it can become infected, you can't get your shoe on, and now you can't dance. So little things like making sure if you have a blister or you see one starting, to use second skin, to use the Band-Aid. If your calluses are getting a little out of control, to take care of them. Because it's very easy for something very small on your foot to become a big problem where you can't actually tap dance anymore. I think because we're usually doing smaller, quicker movements, we're not, taking up all the space in the room. I think it's good to cross-train doing things that do bigger body movements too. So like for me personally, I take ballet, I'll take modern, I take jazz. I'm not great at them, but it's to get me out of being in this little position and actually move my arms and actually, move my legs really big. And then to be aware to not always be in high heels if you don't have to be. There's tons of studies on that they're not the greatest shoes, even though they're really pretty. So if you're going to be tap dancing a lot, maybe try not to wear high heels a lot when you're not dancing.
You mentioned that some of this was in another podcast, so I'm like, this is back to old podcasts today.
I love it.
So for those of you listening who want to hear more about foot health and care, go back to Suzanne Siemenson's episode.
Oh yes, that was when we first started too.
Yeah.
Ooh, I think it was episode number 2.
2 or 3.
Yeah. All right, now we're to our my favorite question. I know Marissa enjoys it as well. Please tell us your favorite story of treating a dancer.
I have 2.
Yes,
I have 2. The first one is for tap dance. My tap dance teacher, Hillary Marie, I was working with her in the fall because she had some shoulder pain going on. Like I was saying before, you don't always think of shoulders with tap dance, but it's important. It was getting in the way of her being able to do things she wanted to do. And a big thing we focused on is getting her shoulders back. And we were talking about how hard it is because when you tap, you're relaxed and you want to come forward. So a few months after that, I was in class one day. I'm like, look at her standing up straight. But I didn't say anything because we're in the middle of class. And then a few minutes later, she stopped and said, did you see me standing up straight? I'm like, oh, I did. Yay. And it's just so great to see, when you see something that you're trying to help somebody with when it worked. And then my second story is completely different. Last year in August, I started working with a dancer. She was 17 and she just had her ACL reconstructed. Going into her senior year of high school, she was a competitive dancer, had been competing forever, just, not the best timing. And so I knew she was really, really disappointed. She worked so hard. And so in the spring, her mom had invited me to her recital. The recital, this one was just the competition dances. And the mom said, normally she would have been in 12, 13, however many dances and featured, but, because of the injury, she didn't get to do very much. So all of the seniors had a solo, and before the solo, they had a little voiceover and photo montage, and she was saying how it didn't start as she wanted to this year. And the mom had said too, normally she'd have these big tricks, but she's not there yet, so that's okay. She was stunning. She didn't need the tricks. Her artistry was so beautiful. So her mom and I just cried through the entire dance. Aww. And it was so, even though I know she wasn't where she wanted to be, because I know she had been looking forward to her senior year, for all these years, she was still able to get on stage and do her solo and do it beautifully.
Nice.
Oh, that's great.
Great stories.
Yeah.
Thank you so much for sharing all your wisdom and for trekking in from Jersey and for shedding light on tap dance, which is a little bit of an underserved
and bringing
population.
us shoes that we get to keep, right?
Shoes are the best part.
Yes. Her face says no, by the way. No. Next time, Jenna. So again, thank you so much. And thank you to all of our listeners for joining us for another episode of Physiotherapy Performance Perspectives. Join us on the first Monday of every month for the next episode.
To hear more of our episodes, click on the link in the description below to view our website. Like us on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, email us at ptperformanceperspectives@gmail.com. Thank you. Bye.
Thank you very much.
Of course. Bye.